Okay, today what we're going to talk about is back labor. You will hear when you're in clinic, on your clinical rotations, you will hear the staff talk about this woman is OP, or she's LOP, or she's ROP, but the thing you want to key into is that she's OP. So first of all, I want to show you, or reinforce for you, because we probably covered this in class already, that normally when babies come out, they come out in an occiput anterior position. And this is where this baby's head, so this baby is straight OA. Its face is down. It happens to be, if this was on a woman, it would be in a full crown right now. But the piece that you want to get is that the baby's face is down. The soft part of the baby's face is against the harder part of the maternal pelvis. This baby is directly OA. Okay, now we're going to talk about the baby that is OP. This baby is coming down the maternal pelvis. The hardest part of the baby's head is now coming down to the hardest part of the maternal pelvis. So it's OP. It is, sometimes you'll hear people talk about that it's sunny side up. Its face is up. Now, for the mother, this is excruciating because every single time that her body contracts, this hard part of the baby's head, because the baby is well flexed, the hard part of the baby's head is pushed against her sacrum, and it's very, very painful for her. So there are a couple of things, and I'm going to talk about the birthing ball in another one, but there are some things that we can do for her. For one thing we can do is that we can keep her upright. Okay, that encourages a larger diameter. When the mother is upright, we actually get an extra centimeter anterior to posterior in the pelvis. So that will sometimes encourage the baby to turn. The other thing that we can do is that while she is having a contraction, we can press the flat of our hands against the lower part of her sacrum. And as the baby's head is pushing back, we're giving counter pressure. And this is not soft pressure. This is significant counter pressure to her back, so that that counteracts the impact of that baby pushing against her. We can also take her and we can put her up. We can let her labor over a table like this, or over, in the case she won't be at a table, but she'll be in her labor room, and she can drape herself over her bed. And just having her up, makes the baby fall forward and brings it off of her sacrum, and that can give her a tremendous amount of relief. Warm compresses to her back, putting her in a deep jacuzzi for a few minutes is also very helpful. Having her partner or the person who's with her massage her lower back can also be very helpful. Oftentimes women who have persistent OPs, which is a baby that does not turn, that is a perfect indication for an epidural. That's one of the times where we can actually say that an epidural is very effective. Okay, that's occiput posterior labor.